Hello, my name is Sharde Wiley. I'm 25 years old and I'm currently working as an optometric technician. Prior to my current job, I was doing patient transport at Franklin Square Hospital during the pandemic, which is the first time I've ever seen or even heard of respiratory therapy. And this was during the pandemic, so you can imagine how many respiratory therapists I was seeing in just one day. I grew curious because some patients that we would have to transport on a stretcher or on a bed, a respiratory therapist and a nurse would be alongside. And I would see the respiratory therapist pushing along the ventilator, which the patient was hooked up to. And I started to ask around like, hey, what does your job entails? Or why is this person on a vent? I just grew curious. So I started to do my own research. And after that, and talking with the respiratory therapist, I fell in love with respiratory therapy, the whole idea of it. I feel like a respiratory therapist's job entails, of course, educating the patients or doing patient assessments or just simple diagnostic testing, or not even simple, crucial, huge testing. I feel like I'm a great candidate for this program because just doing my research and just, talking to the respiratory therapist, I fell in love with it, like how I said previously. I just feel like it's a blessing to help someone get that natural feeling back, which is breathing. I know for sure I take granted for, just breathing normally. I don't think about it. I don't have to remind myself. I just breathe since it's so natural. So I feel like even if it's just a small step, just a quick little breathing treatment or having to be on a ventilator, that will help that person get that natural feeling back, which is the breathing that I talked about. And I just feel like I said, once again, it's such a blessing. I would love to help someone have that natural feeling back. Lastly, I saw the last question. I was like, oh, but if me and another classmate were, to have a disagreement in a clinical environment, of course, I would just straight remind them like, hey, we're here for the patient. Whatever we have going on, or we're not, coming to a conclusion on our disagreement, we could focus on that outside of this clinical environment. We will quickly have to just cut it off. Whatever we have going on, just focus on the patient or the research, whatever we're doing in the clinical environment, and just get that done. And that's how I resolved the issue. But anyways, I just want to thank you guys so much for giving me this opportunity for the interview. I'm praying and hoping that I'll be accepted into the program, that I graduate and become the respiratory therapist. And I also want to give the other candidates a good luck, and hopefully we get inside and we ace this. We got this. Thank you guys so much. Have a blessed one.